You know, in just about every hospital, every ambulance, and even on those intense mountain rescue missions, you're going to find this one little vial. It's a drug that's a true medical powerhouse, dexamethasone. So today, we're going to unpack this thing. What is it, and how did it become such an essential tool for doctors everywhere?
You've probably heard its name pop up, right? Maybe for treating severe COVID-19 or for a really bad allergic reaction. I mean, it's used for everything from croup in little kids to life-threatening brain swelling at super high altitudes. So what is dexamethasone really? And how can one single drug be the right answer for so many different problems?
All right, let's start at the very beginning with the fundamentals. At its core, dexamethasone belongs to a specific class of drugs that actually mimic hormones that our own bodies produce. To get specific, it's a glucocorticoid. Now that's a mouthful, but think of it like this. It's a man-made steroid that acts just like the natural hormones that come from your adrenal glands. These hormones, like cortisol, are your body's built-in response to stress and injury. And one of their main jobs? Controlling inflammation. Dexamethasone is basically a supercharged synthetic version of that.
And that brings us right to its main job. Dexamethasone is first and foremost an absolute master at controlling inflammation. But how does it actually pull that off? What's going on under the hood? Well, it's pretty cool, actually. It fights inflammation in three key ways. First, it goes right to the source and suppresses the immune response that's causing the inflammation. Second, it kind of boosts the effects of other medications, like inhalers, helping to relax the muscles in your airways. And third, it can actually make your airways less twitchy, less reactive to triggers in the first place. It's this multi-pronged attack that makes it so incredibly effective. So, with a powerful mechanism like that, you can probably start to see why this drug shows up in so many different situations. It is just incredibly versatile. Seriously, think of dexamethasone as the Swiss Army knife in a doctor's toolkit. It has a specialized tool for a huge range of problems, from managing chronic conditions day-to-day to tackling sudden, life-threatening emergencies. So on one side of that Swiss Army knife, you've got its use for these long-term body-wide issues. We're talking about managing hormonal system disorders, autoimmune conditions like rheumatoid arthritis, and certain blood disorders. It's also a go-to for just taming stubborn, chronic inflammation, and it can even be a critical player in treating specific types of shock. And then on the other side, you've got its use in really acute, sudden situations. It's used to calm down severe allergic reactions, quiet that unmistakable barking cough of croup in kids, and relieve bronchospasms during asthma attacks. And this is just fascinating. It's also a frontline treatment for climbers suffering from acute mountain sickness, and its much more dangerous big brother, high-altitude cerebral edema, or HACE. In those extreme environments, its powerful anti-inflammatory action works by reducing the dangerous swelling in the brain that's caused by a lack of oxygen. Pretty amazing.
But you know, like any power tool, dexamethasone comes with a safety manual. It's not something you use lightly. So who shouldn't take it? And what are the potential risks we need to know about?
Okay, so there are really two sides to the safety coin here. First, it's a definite no-go if you're allergic to it. That's a given. And doctors have to be really, really careful about using it if you have an active infection, because it can suppress your immune system. Then, on the other hand, you've got the potential side effects, things like slower wound healing, higher blood pressure, even high blood sugar. It's a powerful drug, and that power just has to be managed very carefully. So how do medical professionals get the dose just right? Well, this is absolutely not a one-size-fits-all situation. The amount given can vary dramatically depending on who the patient is and what exactly is being treated. I mean, just look at this table. It gives you a real sense of how much the dosage can swing. A general adult dose is a pretty wide range, but for a child with croup, that's a super precise calculation based on their body weight. For a climber with mountain sickness, it's actually a pretty small amount, but for that life-threatening brain swelling of HSE, it's a massive initial dose. See, context is absolutely everything when it comes to dexamethasone. Okay, so we've covered what it is, how it works, and how it's used. But there is one more piece of the puzzle here, and it is absolutely critical for understanding this drug's role, especially when the clock is ticking in an emergency. 4 to 8 hours. Remember that number. That's how long it takes for dexamethasone to really kick in and start working. In an emergency, that delay is the single most important factor in deciding whether or not it's the right tool for the job. And here it is, the key takeaway, straight from the clinical profile. Because of its slow onset of action, 4 to 8 hours, dexamethasone should not be considered a first-line medication for allergic reactions.
Think about that. In a severe allergic reaction like anaphylaxis, you need something that works in minutes, not hours. That's why you have things like epinephrine. Dexamethasone is a powerful backup, a great second-line treatment, but it's not the first responder.
And just a few final quick points to round out our understanding. For pregnant patients who need long-term steroids, other types are usually preferred. It's got to be protected from heat to stay effective. And for kids, if getting an IV is going to be tough or cause a delay, giving the shot right in the muscle is a perfectly good option.
So we're left with this thought. Dexamethasone is an undeniable medical workhorse. It's this versatile, powerful tool that saves lives by shutting down inflammation. But its true strength lies in its steady, potent action, not its speed. And understanding that difference, knowing when you need a fast-acting rescue versus when you need that slower, powerful response, well, that's what makes all the difference in an emergency.